Welcome to part two of our conversation. If you missed part one, be sure to go to our podcast library and get caught up. Without further ado, please enjoy the rest of our conversation.
Does it ever happen that you have somebody that comes in your eye, has no refractive error, they don't have any discomfort or anything like that, they just want their vision to be better? Like, I'm thinking like an athlete that, hand-eye coordination and things like that. Is that something that would be beneficial to of that sort?
There's a lot of athletes that do vision training that don't tell people training. So yes, because that's a whole, sports vision training is a whole niche in itself. So a lot of people want to do eye-hand coordination. In terms of our actual practice, Cristina, we had
a patient. She was on the Canada women's national soccer team. So was one of these a forward, and now she's at UCLA. Is going to school there. We also had, she was the top 10 girl in Canada for golf. She just finished, and actually I saw on the weekend she's playing with under 19-year-olds now. She's only 10, and she's like the best in Canada for her age. We've also had rugby players. We've had tennis players or people who play leisurely, stuff like that. A lot of hockey players. We've seen a lot of hockey players come and go. And it's just because, some of them come in for different reasons, but often they come in and they find that their sport is so much better. Like we had one, it was a couple brothers who came in, and one of the brothers started going with us, and he went from, scoring once or twice a season to scoring almost every game, and incredibly changing the way he loved everything, and, going different ranks and things like that. So, for them, they love that more. And for us, we just see a big difference in terms of them individually, school, and performance-wise, right? And that a lot of them attested to vision therapy, which is great.
I just heard Cristina can resolve some of my golfing issues by solving a few strokes off my game card at the end.
There's a great activity that's probably can help.
Well, at least now you have an excuse, Martin. You can have I have a vision problem. Dr. Ramesh, you mentioned seniors. So that makes me think, because, I was thinking vision therapy, and I only was thinking of children, of course, traumatic brain injuries like that. So would you say your practice sees more children than adults, and parents are bringing them in, or do adults realize that it goes beyond? Because we know that most practitioners aren't going down this road and offering these services. And maybe it's up and coming, but more and more people have to be aware of it. So is it mostly kids, or do you get a fair amount of adults?
No, our practice it's every demographic. And in terms of the patients that we actually have in vision therapy, same thing. I think we're split evenly on adult children. So, and for adults, it's not just adults that have had a concussion or a vehicle accident. There's a lot of adults that come in and they'll see what we're doing with children, and they'll tell us, they'll say, you know what, when I was younger, I struggled. And right now when I work, I struggle. I'm not efficient. And they will literally break down and cry. I swear, if you come into my office and you don't cry, there's a problem.
Yeah.
So they all come in and we support them as well. So we've literally got all ages. And
yeah, I think the youngest we've ever had was 2, and the oldest was, I think, 75.
Yeah.
Something like that, yeah.
Wow, so it sounds really rewarding. As opticians, we find it really rewarding too when someone puts on those glasses and we've given them sight, or we fit a diseased cornea with a special contact lens, and people, no one had ever offered it to them before. And in my years of being an optician, I find it extremely rewarding, and people, they love you for it.
For sure. And we have opticians in our office, and you know what, they're great assets when terms of vision therapy. So, sometimes often the doctors are busy, and as a therapist, we're sometimes given their chart and we see their prescription, or, they get new types of glasses. So I personally often go to our opticians, who are all super great, and they help me understand, right? And that's why our office really likes everyone to work together, because it's an inclusive area. We all need to work together, and often they'll come ask us. They'll have patients in front of them, they're dispensing, and then they're talking about all these problems. They'll be like, oh, will this help? And then this is how we get kind of the word of mouth going in.
I think that's what people don't realize. The difference between vision therapy and anything like occupational therapy is that lenses. And that's what optometry has the power of. Lenses are so powerful and people have no idea what they're capable of doing. Like, we are in such a powerful field that can actually impact how your brain functions. And that's what's so amazing about vision therapy is there's a huge lens component. So it's not just doing exercises. A lot of the exercises are with prisms and with lenses and other filters and stuff.
Is this an expensive thing to go after? Does OHIP pay for an assessment? Like I obviously typically you bring some assessment chart out. Is this something that OHIP pays for at all, or private insurance mostly?
OHIP does not cover it. There are insurance that do cover it, so you'd have to look at a company or pay out of pocket. Honestly, though, you can't put a price on being able to function, being able to say, hey, I was told I could never work again, but now I'm working. Being a mom of 3 kids and saying, wow, I don't have to sit down and do homework with any of them. I can pay attention to my little one while my other 2 do their homework. Being a parent of someone who has a turned eye and not worrying that their child's going to be made fun of because their eyes are crossed because now their eyes are straight and they didn't need surgery. And I talk to all these parents and I say, here's a symptom, what is it worth to have this fixed for your child? You can't put a price on that.
Yeah.
And to be honest, I mean, I'm a patient myself. Cristina was actually my therapist.
Sure was, yes.
To know the difference, and what I tell people is, we know we're going to get the academic changes, we know we're going to get the visual changes, but what her and I look for is the confidence in people and the smiles. And even for me, I mean, I was a completely different person before I had my therapy done. And now I'm just like, hey, look at me, let me chat about things. And I'm out there and I want people to understand what you're capable of and how you can process a world so differently, because all of these people come in, so many young women come in with anxiety. And they just don't understand. And we talk to them and we say, you know what, try this. And eventually they do it and they understand that it's not anxiety. It's just that they were processing the world differently than the rest of us.
How can our listeners get more information about vision therapy?
So Vision Therapy Canada, visiontherapycanada.com is a website that people can look at that tells you about all the doctors within Canada that provide vision therapy. They've got information, I think, there for parents, children, but they've also got information for other practitioners that wanted to be interested in vision therapy. So that's probably one of the best sites to go through in Canada. There's a lot of other websites. There is the Vision Help Group, which talks to a lot of parents, like different blogs and different research studies on vision therapy out there.
I'd really like to encourage our optician colleagues to look into vision because we're always looking to expand our practice and to work side by side with optometrists. More and more opticians are in group practices now. And obviously vision therapy is something opticians should be looking to. And it forms that bond again because we need, just like in all types of healthcare, for our eyes, we need an eye care team to help us.
100%. And, we've got, like Cristina said, in our team, we've got opticians, we've got vision therapists, got the doctor, but our opticians are trained to understand what we call neurofunctional lenses, like how to prescribe differently than what you might have been taught in school, and to really understand what we say with these, how we want the heights raised and how it's different than what you would traditionally. And I think it's really important for opticians to understand. So, even if you had an optical on your own and an optometrist prescribes, so then you can still work with that patient and provide the goods and not say, oh, I can't use glasses. I think it's really important that opticians understand that it might look a little bit different and understand how to fill that prescription.
So that was great, Dr. Ramesh and Cristina. We really appreciate you coming on today. I think you give us a lot of information, and I think our listeners, they'll be looking at their vision a little differently and realizing that just seeing, you can always see better, but the idea is to see the best you can and see comfortably. So once again, thank you guys for coming on, and we will disseminate links that you mentioned and hope that people look into vision therapy. So thanks again, all the best, and be safe.
Thank you.
Thanks for having me.
Thank you for listening to See What We See with Lorne Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lorne and Martin. Take care and stay safe.